Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. And today I would like to share with you how to manage the pediatric patient, especially when you're taking radiographs. So I just want to fully share. I've been a hygienist a long time. And I just can't even believe it to tell you this. So I was tasked with taking bite wing X-rays on a little girl last week in clinic, and I was unsuccessful. So it was actually a really good experience for me because I just, I just take X-rays, don't think anything of it, and over time, as you overcome some of the challenges with taking radiographs on patients, you almost forget some of the techniques and management strategies that you need to have in order to be successful working with patients. So I figured it was time to record this episode, have a piece of humble pie for myself, and share that I was unsuccessful being able to take radiographs on my patient for a student. So let's talk about how to best manage your pediatric patient and really any patient, but I'll start with pediatric patients only because that's what's prompted me to record this episode is my experience with that pediatric patient that I had. So children love to just really dissect body language. I will just tell you that for sure. You want to be confident when you approach them to take a radiograph because when you are confident, they are trusting you, they feel secure, they understand things that you're saying, but they see and feel things a lot more. So you want to make sure that you are so confident that this is going to be easy peasy, that you are just going to take a beautiful picture inside their mouth and you're going to show them all of their teeth. It's that whole show, tell, do. You're going to show them the sensor. You're going to show them where they're going to bite their teeth. You're going to show them the lead apron and that it's heavy. It's like a weighted blanket, and you're going to protect their thyroid and all of the things because of that inverse square law. All they're smaller people, so we have to keep that into consideration. But also, we want to talk our patient through that process. We want to reassure the child that this is what we normally do. And I like to say to the little kiddo that we're taking a photo, we're taking a picture, but this is a different picture that we're taking. One like nothing you've ever seen where you take with, or maybe your parents' iPhone doesn't take the same kind of picture as this. This is a special picture that we use in dentistry, but some of the same things qualify. Number one, you have to stay nice and still so that the picture comes out really crisp and clear. And number two, we have to put the picture in the right place so that we get the right picture of the right images. So sometimes if you can relate real life experiences with what the patient is, what our expectation is of our patient, it really helps them. We're going to show them how to stay still. And sometimes it's really challenging for a little one is to stay still. But I will share this patient that I was not able to take radiographs on the other day. She was totally still. She was totally fine in the chair. And I did all the things that I'm telling you, and I was still unsuccessful. So keep that in mind. And honestly, we don't want to push our patient. So I always give it like the rule of 4 is my rule. So I will give it 4 tries, and I will do different strategies and techniques with those 4 tries. And if after 4 tries, the patient is starting to get a little bit anxious or there's a challenge involved there, I'm going to postpone until the next visit to take radiographs. And that's exactly what I did the other day. This was her very first time having radiographs taken. I tried 4 different ways. I tried all the different tactics and techniques where I showed the patient where they should feel the sensor on the inside against their tongue, and they should feel it on the roof of their mouth and the floor of their mouth. But that's okay. That's where it's supposed to sit. and they're going to bite on the little red tab. I showed the patient where the little red tab was with their upper and lower teeth, and it's just going to come together. And then when they bite down, that puts the sensor in the right place. And then I'm going to point the camera right at their cheek, and they stay nice and still, and we take the image. So this particular patient had a really hard time relaxing her tongue. So we were trying all the different little things. And the more I mentioned, one thing I will say, you don't want to mention that their tongue is what's giving you trouble, because the minute a patient thinks about their tongue, they just start doing really weird things with their tongue. So I was trying to get her to relax her tongue without actually saying the word tongue. And you never want to say the word hurt or pain or any of that. You're just going to say, you'll feel it. You'll feel it against the inside by your tongue. You'll feel it bite down. And that's when we know it's in the right place. And sometimes if a patient has a high risk and the radiographs are completely necessary, there might be different strategies that we have to use, and we might have to look into maybe a Panorex for this particular patient if we can't get something intraorally. And things like the dental needs of the child, you really have to think about that, and how emotionally stable the child is, how cooperative they are, the size and shape of their teeth. I actually start off with the Dexis 1.5 sensor, and then I move to the pediatric sensor if I have to. And honestly, sometimes when you tell the patient that you're getting the smaller sensor, sometimes that's all they need to shift their mindset that, oh, it's too big for my mouth. Now she's getting something smaller. That should work. That should fix it. And sometimes just, you might not even actually change the sensor, but it's the way that the patient perceives that you're getting a smaller sensor that helps them kind of relax and calm everything down. For this little tyke, I have to say I went to the pediatric sensor and it still didn't work. No matter how I tried to position the sensor, she just by then was too ramped up. I thought, okay, a 6-month pause is essential here. And she didn't have a gag reflex or anything. And she had her little stuffy with her, but it didn't quite, she had a hard time keeping the sensor inside. She kept pushing it out. And it may have been that she had a gag reflex. We never quite got to that level of cooperation. So some of the things that you want to keep in mind. But the techniques for a child are really similar to an adult. You may not be able to use the RIN. So for this particular situation, I was just using a stabe. I was just using the stick-on for that particular patient, the really tiny stick-on, so that I had minimal equipment, so that the perception was that very little things were involved there. And the little bite stick, just, it feels like it's less for the patient, but it's also perception for them. And the other thing that I want you to think about is you always want to ask their permission. Please open. Could I have you open? This is going to slide right inside. Kind of walk your patient through the process. They tolerate discomfort a lot better when you explain the process. And this goes for children and adults. And you never want to use, like I said, you never want to say hurt. I just say, you'll feel that sensor against the inside by your tongue and the roof of your mouth. You never want to use the word gag. Once you say the word gag, you're done. You're dead in the water. You're not getting a radiograph on your patient once you say the word gag. Or with a child, if you say the word hurt or pinch, this isn't going to hurt. That actually sends the sensor for them to think that it is going to hurt. And then the other thing, it does matter. You want to have them close slowly so that you're able to position the sensor in the correct spot and kind of make adjustments as they close their teeth together. As they close their teeth together, if you are moving the sensor a certain way, you can keep that sensor from moving into a place that may actually cause discomfort for them. And those are really important little techniques that you can do with your patient. You also want to keep in mind that being prepared and efficient is super important in this particular case. So if you have a little one that you're going to take radiographs on, you don't want them sitting there thinking about it and you're getting everything ready. You want to have everything ready, all of your equipment ready to go as soon as they sit down. And take care of your patient first. You want to make sure that you begin by having everything ready, explain to them what you're doing, show them the sensor, show them if I happen to be using the Nomad, I showed them my camera. I'm going to take a picture of your teeth with this camera. This is the sensor that actually captures the image inside your mouth of your teeth. And this is the camera that takes the image. It captures the image and puts it in your computerized chart. How cool is that? And when you tell your patient what you're doing and you show them all the equipment and you're ready to go, all of your equipment is ready, they're not sitting there waiting around, wondering and building up anxiety in preparation for what you are about to do. Now, there are so many hurdles that you can run into besides a gag reflex. Things like tori, oh my gosh. Or if your patient has a really shallow palate and there's not a lot of space or room for the sensor, or maybe they have a maxillary torus, and so you have to position that sensor on the other side of it. All of these little challenges that come your way kind of impact how you're going to approach that patient to position the sensor so that you can actually get the right image. So when you have anatomy challenges, you want to know that ahead of time before you actually have the sensor in your hand. This is why we do an intra-extraoral exam before we take our radiographs, because when you are prepared and you are aware of maybe your patient having mandibular tori, bilateral tori that are really large, as you approach your patient and you're going to take that radiograph, you know that that anatomy is there, so you can plan your positioning and plan your strategy on how you're going to take that radiograph on the patient because you've done your homework ahead of time. Having those challenges, but being prepared ahead of time goes a long way at you looking confident to your patient. Confidence is key and preparation is key. So if your patient sees that you not only have communicated well with them, but that you know their mouth, you understand how you're going to approach taking these radiographs with your patient because you've done your homework and you know exactly how you're going to place that. That really goes a long way at building the confidence and trust between you and your patient so that you can take a quality radiograph. The other thing I just wanted to say, and I'm just going to fully say this because I was unsuccessful the other day. It's important that you're kind to yourself. If your patient is there, you've done everything you can to prepare, to plan, to strategize. You understand what your obstacles are. You communicate, you build trust, you're confident with your patient. You do all of the things, and you're still not able to get a quality radiograph or even one image. Maybe the child did not allow you to do any of it. It's okay. It doesn't mean that you're not capable. I just did it the other day. This is why I'm sharing this with you, because I know that I'm still a good clinician. I still got it. But I will say that as a new clinician or even as a student, you may beat yourself up a little bit, have a little bit of self-doubt, create a little bit of self-talk that's not okay. Do not allow that, okay? Just let that stuff go. Dentistry is hard enough without you being mean to yourself. So I share this because, my goodness, if I can't get a radiograph on a 6-year-old girl, and I tried all of the strategies and tactics, guess what? It just wasn't time to take radiographs on her. We'll try it again in 6 months. And you would be amazed at, number one, what 6 months does as far as the development process for a child and how much they grow, but also the time of day, what they've gone through, how well they slept, how did they eat a good breakfast? All of these things play a part in how a child is going to respond in your chair. Now, there's a lot of things that come up when it comes to radiology. And you are going to come, I think radiology and taking radiographs is probably one of the biggest challenges as a dental hygienist. Not just the technique of taking the radiographs, but the conversations and the complications that come up around radiographs. Patient doesn't want to have radiographs. How often should we take radiographs? What do we do with radiographs once we have them? Who owns the radiographs? How do we share the radiographs? Can I take radiographs on somebody doing chemo? Can I take radiographs on a pregnant patient? Should I take radiographs more often on my high caries risk patient or my perio patient? I feel like I could do 10 episodes just covering radiology topics of conversation. Just know that when it comes to your patient and having conversation around radiographs, and when you're talking about a child and trying to get radiographs, you have to consider the risk level, how important it is for you to get those radiographs today. Does your patient have a pressing need? You know, it's one thing if you have a patient who's having bite wing radiographs for the very first time and they're 6 years old and there's no evident areas of concern when you look in their mouth. It's a completely different story when your patient is sitting there in the chair and they have a swollen face and they're 6 years old and you can see evidence of an infection. You have to try to manage that patient to get at least an image of that sick area, that really chronically problematic tooth that's going on, or maybe it's an acute issue that brought the patient in. All of these things play into how successful you're going to be and the urgency of the outcome for you to obtain a radiograph. So all those factors play a role. Obviously, for this patient who was in my chair and I was unsuccessful, there was no reason for me to push the issue. And I know just from experience that if I see this patient in 6 months, she's going to be 6 months older. She'll also have had the experience that she had with me the other day, where I explained all of the parts and pieces, and she got to see the sensor and see the nomad. So these things will be more familiar to her. And so that will not all feel so new and overwhelming to her. And that sometimes is the key piece to helping your young patient go from maybe radiographs today to successful radiographs today. So hopefully this was helpful. X-rays are challenging. Every patient is just a little bit different. Your techniques and strategies will develop and grow as you grow as a clinician, but do not be afraid to have an unsuccessful event and know that you did your best and that's all you can do. And your patient just needs to come back a little bit older and you can try again. So don't take it personal. I hope you guys are having a great week. I ask that you share your podcast, my podcast, with your friends. Tell them that it's helping you. Let them know that how much you've utilized it on your learning journey through dental hygiene school. And if you didn't try out the scorecard, I would encourage you to try out the scorecard to kind of see where you rate yourself as a successful dental hygiene student, and maybe take some of the suggestions on the scorecard of different things that you could implement to help you be more successful as a dental hygiene student. I hope you guys are doing well, and I appreciate each and every one of you. We'll see you later. Bye.